Hi, everyone. We are live with Wellness Chats with Nisha. I'm Nisha Khare, and we are here with Stigma-Free Society. And today we have a fantastic interviewee who I will introduce in a moment. And just want everyone to know that I am excited that you are going to be joining us today. I am the founder of Human Biography and Women of Wonder. I'm a director, producer, and a registered clinical counselor. And through this Facebook Live event, I'm representing the Stigma-Free Society. They are a Canadian registered charity that aims to reduce stigma of all kinds with a focus on mental health. So Stigma-Free promotes mental wellness education for youth while providing resources at the same time for educators and school counselors, parents, or guardians. And the Society's goal is to create awareness of the various stigmas that exist in the world and help us understand the challenges that numerous people face and encouraging people to accept themselves as well as others. And to learn more, you can go to www.stigmafreesociety.com. And so I would like to welcome Hannah. Hi, Hannah.
Hello. Thanks for having me today.
So happy to have you. Really excited about this chat. I just in the few minutes before that you and I were connecting, I was loving everything you're saying. So I think that this is going to be a really great chat for people to listen to hear, and to just have a new perspective in life. So I'm going to tell everyone a little bit about Hannah. Hannah Glenn is a doctoral student in counseling psychology at the University of Wisconsin-Madison. She's drawn to counseling because she wants to become a multiculturally competent psychologist, a psychologist who can truly see and support the healing of everyone. Hannah approached counseling and psychology with attention to a person's identity, worldview, and cultural upbringings because they inform the way that we navigate the world. One of Hannah's main goals is to make mental health information and mental health care accessible to everyone. She has noticed a trend that when people don't have access to mental health care, they often turn to the interest and social media to make sense of their experiences. And Hannah really wants to make sure that there's evidence-based, incredible information about mental health and psychology available to the people who've begun their search, and that led to the creation of BIPOC_mental health on Instagram. So definitely check that out. It's a great resource. And Hannah's goal is to share mental health and psychology information from a social justice lens for Black and Brown folks who haven't been well represented in psychology. And being from a background of counseling psychology myself, this is just I am, wow, fascinated by everything that you're saying, and from the perspective you're bringing it to us. So perhaps you can tell us a little bit more, Hannah, about your educational background and also what sparked your passion for psychology.
Yeah, so as you mentioned, I'm working on my PhD in counseling psychology at the University of Wisconsin-Madison. Counseling psychology takes a really social justice and diverse approach to psychology and to psychotherapy. And so that's part of what drew me to counseling as a whole. Let's see. Another thing that I love about psychology, and another reason why I decided to study it, even as an undergraduate when I started my bachelor's degree, is everybody has thoughts and feelings, and it's just part of the human experience. It's like the science of the way that we navigate the world. And because it's something that everybody has, I wanted to study it and I wanted to learn more about it. And that's really what brought me to counseling. And then, of course, with my own values within social justice and diversity and representation, counseling psychology just seemed like a really great fit for me.
I think it's a perfect fit for you, Hannah. So what barriers do you think currently exist in the field of psychology that can prevent BIPOC folks from seeking mental health treatment?
Yeah, so I think that there are a lot of barriers, and I'm going to try and break them down. So yeah. I think there are three areas that I want to go to. So the first of which is when folks reach out to a therapist to actually go to counseling. And so one, if Black and brown folks, when they go to counseling, like something that can be an experience is being microaggressed by their therapist, where there's like a comment that is kind of racist, but was completely harmful and wasn't intentional. And that can be really harmful, that can be hurtful, and that can make folks not want to go to therapy if that's their experience. So that's one level of it. Another level within this one block is that because of COVID and because of the racial climate in the United States, there are a lot of wait lists to get connected with counselors. People want therapy, and at the same time, there's not enough of us and not enough therapists who are able to provide that counseling. So sometimes folks will reach out and they're like, yes, I need help. I'm going to reach out to a therapist. And then they find that they're on a wait list, or find out that the person that they want to see isn't accepting clients, or it's going to be 12 weeks. And that can be really hard when you want to reach out now for help. And so even just having to wait for mental health care is another challenge that exists for people when they want to make it happen. So those are the two big things that happen once we do reach out. But there are also other things that prevent people from reaching out. And so one of which is the cost of therapy. Therapy is so expensive. And I asked a question on my Instagram probably a month or two ago and was like, do you think therapy is a luxury? Almost everybody was like, yes, absolutely. This is a luxury. I cannot afford to go. It's too expensive. Based on hourly rates or how much insurance is willing to reimburse. It's just not feasible for a lot of people. Yeah. That also leads into the challenges with insurance coverage. And is their insurance provider actually going to cover the cost of therapy, or will they cover enough of it to make it affordable? In addition to that, it's also timing. Do people have time to go to therapy and to really put the time and effort into the work? Because therapy is hard. You're going through and you're challenging all of your experiences, really digging up some deep, dark memories, trauma, and you're working through it. And it's like, do I have the time to dedicate to this right now? And I think that that's a hidden cost. While it's not a monetary one, it's also, they can be expensive in that sense based on your time, if that's something that you want to do. But with that, it's also timing intersects with money as well. So if you want to go once a week, that's 4 times. If the rate is $100 an hour, then you're paying $400 to go to therapy. So there are those barriers that exist too. And what can you get to therapy? Do you have a proper transportation to get there? Do you have childcare once you're there? Or if it's still virtual due to COVID, do you have a stable internet connection? Do you have a webcam? And those are all also barriers as well.
Wow. Yes. Oh my goodness. So I hear what you're saying. Now, even when I suggest to people, which I do a lot because I really believe in counseling, that if something's going on in their life, like, have you thought of counseling? And first of all, it's how do you find the right counselor, right? So like, how do you find the right one? And then if you do find one, how do you get in to see them? And with COVID, people might want to see somebody in person, and it can be a challenge to see someone in person right now because you have to be safe and protocols, but sometimes how do you get into the right people? And I love that you're bringing this up too. Like, counseling's not cheap, right? It costs money. However, it's also changing the mindset that, okay, if you're going to put money into like a dinner out or a new outfit or something, it's like trying to work in the idea that you are worth it to put that money into yourself too. But we just haven't been trained that way to see that is almost like it should be an automatic pot of money we put aside to help ourselves.
Yes.
Sometimes people don't have that money to put aside. There isn't that extra.
Yeah, absolutely. There was a therapist that I saw when I was in college, and she said, and it will always stand out to me, and I use it with my clients now, it's that we go to the eye doctor regularly, we go to the dentist regularly, we get our hair cut frequently. And so even with that, we are putting more time into our eyes and our teeth and our hair than what we do for our brains and those thoughts and feelings that we live with every single day. And that's not to put down dentistry or optometry, because those are all very important, so you should go. And it's just to highlight the fact that that's a part of our health and our well-being that we have been taught as a luxury, or we've been told that there's a lot of stigma and you shouldn't go, or we should keep matters within the family, or there's someone else that you can talk to about this, that make it really hard to access, whether that is due to the fit of counseling, whether that's due to all these structural barriers, or just messages that you've gotten.
It's so true. There's so many people that I've spoken to that are like, well, I don't need counseling. Like they could be going through the most horrendous thing in their life. They're like, I don't need counseling. Counseling's not for me.
Mm-hmm.
Counseling is for everybody. It's actually like, that's like, do you hear people say that the optometrist is not for me or the dentist is not for me? No, you still go because you know you need to. So I think these are super important things that you're bringing up. And it's like, how do you think we can change the mindset of humans to embrace counseling as like one of those things we just automatically need in our life, and that it's important?
Yeah, I think that I think there's a lot that can be done. Yeah. I mean, one of which is we have to make it affordable, where it isn't going to be this huge expense that you have to budget for and plan for, if you even have the means to make that happen. But it's also, we have to talk about it. We have to talk about mental health, and we have to talk about therapy. And I think that people are doing a lot more of that now. I don't think that was the case even 5-10 years ago. Where it is talked about regularly. It's like, oh my gosh, guess what my therapist said? And I think that happens now, and that's awesome. And it needs to keep going. Because once we talk about it, it makes it seem less stigmatized. And once the stigma is decreased, it makes it easier for more people to feel open to even going or considering that being an option for themselves.
100%. I'm always very open about like my counselor, and I love my counselor, or my husband and I see a counselor and they are amazing and they have this impact in our life, and we wouldn't be where we are today without them. And so I feel like the more people I can tell that to and spread that message, that might plant a seed within them to think like, oh, okay, maybe like counseling is cool, or maybe like, and just that, I think talking about it, exactly. That's why Stigma-Free exists. Let's talk about these things. Because
absolutely.
They matter and they have an impact. And so speaking of impact, what impact do you think there is in having culturally, racially responsive approaches in a psychological practice?
Yeah, so that's a big, important question. And I feel like it's going to take me a minute to get to the point of why I think this is also important, because I could talk about this for days.
You have enjoy. I'm interested.
But I mean, the human experience will always be through our own personal lens, where we are all constructing meaning of the worlds that we live in. We are all having experiences, and we collect these experiences. And some of those major lenses that contribute to the way that we have those experiences are our identities, whether that's your racial identity, your sexual identity, whether that's your gender identity. There are all these different identities that we have that will shape the way that we navigate our spaces that we live in. And that could even be like our social class. These will all inform our worldviews. And so once we are living within a certain worldview, that's the lens that we use to make sense of our experiences. And so even beyond that, we also have our own cultures. Everybody has culture, and that also impacts the way that we navigate the world, the way that we make sense of our experiences. And so with that, it's important for a therapist and psychology as a whole to be able to recognize that. To recognize that there isn't one true human experience, there is no objective truth, and that every single person is living their own truth that is theirs, that they have constructed based on the way that they are going about collecting these experiences and navigating the world. And the things that stick with us and our memories and our traumas and all of those, we hold those with us. And so again, the field of psychology has to meet that. Let me rewind for a second. I think psychotherapy is absolutely beautiful, and I love it. And I think it's an art to be able to practice and provide for people. And at the same time, we can't provide it accurately if we aren't taking into account everybody's experiences and the lens that they see the world through.
Yeah, I love it. As we were talking earlier, what you were saying is that how, when we look at the psychology books and who we're studying and who's in that and who's represented in that book, I hadn't really necessarily thought of the fact that, like, who's writing it, like you brought that to my attention. Are the people who were writing, you know, what we follow to be true for psychology, did they look like me? Did they represent anyone that maybe was like me? It wasn't like that. And it's so great to bring awareness to this. And I feel like, Anna, you should be writing some books about things, you know? I feel like that should be in your future so that you're part of forming and shaping that future of what psychology looks like and how it impacts us, all of us, not just a specific market.
Absolutely. I would love to write a book someday. I love books. If you can't tell by my bookcase behind me, there's a matching one over to the side.
Yes.
I would love to. But with that, I think that it's important to look at who our theorists are. And oftentimes they are middle-aged white men in the 50s. And those were the theories that they came up with, and we use them. And they are theories for a reason. Like, they work, they are valid. And at the same time, we have to make sure that they encompass the broader human experience rather than coming through a westernized white lens, because the majority of the world is not Western nor white. And that's just something that we have to attend to and use in our science.
And I love that, because what you're like, obviously the work that people have done to lay the foundation is so important, and we appreciate it. And it is everything, because at least they give attention and focus to that, right? And yet at this stage now, let's broaden that. Let's encompass more. Let's bring more people into the conversation. Let's take into account all the different things that have impact. And that's beautiful, because then perhaps what that will do is also welcome in more people to feel comfortable in counseling. And, you know, like that would do such good for the world. It would be amazing.
It really would.
And there's so many intersections of identity at play with mental health, right? It's not just gender, it's not just age, like there's so many things. So how do you bring awareness to the intersections into the work that you do to also help other people be aware of the intersections at play?
Yeah. So again, it's like our identities, those are the lenses that we use to navigate the world. And that will always play a role in the way that we also make sense of our experiences. And they will also lead to some of the experiences that we do have, especially if you do have a marginalized identity or an identity that is stigmatized. And so while that, unfortunately, so for a therapist, something that should be done is, what does this mean to you? How do you make sense of this? Like, where does that come from? What do you think about this? What would your family think about this? What would your friends think about this? What would your, what would your teachers think about this? What if your school or your job knew about these things? Like, what would that mean, or how would they make sense of it? And oftentimes those are the messages that we're getting. And so for a therapist, it's important to ask those questions. Like, what does this mean? What would this mean to these people? And then what specifically does it mean to you? Or how does that sit with you? How does this impact you? And it's all through this openness and wondering that allows us to really get at the intersectional identities that we all have, because they do contribute to the ways that we make sense of our world.
So important. And so, like, even from the psychologist's point of view, but also from the point of view of the person getting counseling, to know that you can share all those things. You can share, like, you know, I'm worried about like this, or what do these people think, or these people in my life, or I think this is a perspective, this is how it makes me feel, because that all is relevant. So, like, as much as you can share what's going on around you and within you, the more you can like go deeper into like what might be causing you anxiety or stress or whatever it is, depression.
Exactly.
The root of it, right? Because we're not existing solo. We exist in community, and community has an impact on us, right? And it's a good way to get to the heart of it. So what do you think, what role can unconscious bias play when it comes to a psychologist's treatment of patients? So, like, you know, we don't know what we don't know. So what role can it play?
So unconscious bias plays a really big role. It's important for a therapist, a psychologist, counselor, social worker, human services worker, anybody who works with people or patients or clients, to make sense, to take note of what assumptions am I having and where do these come from? Why do I have this assumption? Recognizing that it is unconscious and it happens, but it's important to bring that awareness to it. It's like, oh, why did I think that? And it's important to realize that and then challenge that. Okay, so I thought this, but let me take a step back and recognize that that isn't fair and that is an unconscious bias that I'm having. And then going toward and seeing the person as a whole, like, who are you? What is your story and what is your experience? And it's unfortunate because I do think that these unconscious and implicit biases do largely exist in our field. There's a study, I'm not sure what year it was or who the authors were, but nonetheless, they found that Black and Latino folks were more likely to be diagnosed with psychosis or psychotic disorders when, like, disorders such as bipolar disorder might be a better fit. So it's just recognizing that there is that unconscious bias that can even lead to misdiagnosis in marginalized communities.
Wow.
And that's important for us to pay attention to that. Like, why is that? Why are we come in with this unconscious bias or this framework when we pull out the DSM and we're going through and diagnosing, like, yes, that fits, leading to these misdiagnoses when it's just inaccurate and incorrect. And so it's important, as I talk about how everybody has their own lens that we view the world, psychologists and therapists also have those. And so we have to be aware of those so that way we can undo that unconscious bias. We can make sure that we are seeing our clients for who they are rather than the set of assumptions that have been ingrained in us.
So how do you think we can do that? What are some ways we can start to become aware of the unconscious bias?
I think the start of it is, one, being open, being ready to learn, being ready to be called out or called in. It's recognizing, like, is this rooted in something? Like, where did this thought come from? Why am I thinking this? Yeah. And then really doing this deep dive and examining. It takes some self-reflection and learning, like, where is this coming from? And then it also takes intentional steps to not do that. So one is developing this awareness. Okay, I was called out. I said, I thought this, like, where did this come from? This was inaccurate. This was biased. This was a racist comment that I made or that I had. And so what am I going to do to, one, challenge myself, and two, how am I going to fix this for the person that I just harmed with this?
Yes.
It's important to acknowledge that the biases that are held do lead to harm. And
harm not only of an individual, but harm of an entire community. Because
exactly.
If there is misdiagnosis, then what happens? People will be reticent to then go see a counselor again, or someone because they're not getting help, but they're like, wait, now I'm being called this or that, and that doesn't actually seem to fit right with me. And actually it seems like more judgmental than authentic. And then we shut down. Right. Yeah. Or that misdiagnoses could be hard to share with people because those words are more triggering than, like, what I actually maybe do have or experience. So, wow, like, what an impact, and what responsibility really we have in the mental health field to be aware of, like, the conversation and what we're doing, and, like, that's why it's so important, to constantly be looking within as a therapist or as somebody in the field or somebody who is referring people. What advice would you give to psychologists on how to deconstruct these potential biases towards these patients?
Yeah, I mean, I just want to say, I think it's our ethical responsibility to make sure that we are continuing to engage in the self-reflection and making sure that we aren't perpetuating harm and that we are challenging our unconscious biases and we're always continuing to learn. Advice that I would have would be just continuing to be ready to learn, ready to do that deep dive within yourself. You can think that you know it all, but no, you don't. And just accept that there is always more to learn. And then also recognizing, when is the work that we are doing causing harm? Is it coming from this very Western lens that doesn't quite fit? Is it coming from this capitalist lens that doesn't fit, that is causing harm to our folks or to our clients? And so it's checking in, making sure, like, how is this fitting with you? Or continuing to ask for feedback, like, about the therapeutic relationship and the treatment progress, and things along those lines. And if you're told something you don't want to hear, don't be defensive. Say thank you.
Yeah. Wow. I love it. And Hannah, would you be in the future considering offering workshops to therapists or people in the mental health field on these topics? Because
in the future, maybe
it would really be helpful to people. Or if you do your thesis and it's focused on this, like share it with the world. Because I think this is something that people would really benefit from now. Hopefully profs will pull examples of your paper into their classrooms to talk about it.
Oh, that would be amazing. I would love to. I think it improves our field and the science and the service that we provide.
Yes. What an important area of work. And, what personally for you, what drives your passion for this work? Because I can see you're passionate and it's making me excited. And that's why I'm like, you need to share this. And you have your Instagram page, which I think everyone should follow. I think it's very helpful. But what personally drives you for passion in this field?
What personally drives me? I think when I have the opportunity to work with a client, it's recognizing that is a very special relationship that is unlike a lot of relationships that we have in our lives. It's a privilege to be able to hold those deepest, darkest secrets, the traumas, the inner workings of somebody's minds, or the way that they think about things that might be embarrassing or stigmatized, and being one person who can hold all of that for somebody. That is just a huge privilege and something that I don't take lightly. It means a lot to me, and I think that it also means a lot to my clients, or any client who has ever worked with a therapist, knowing that person is there and can help support them through all the things that live with us nonstop, those thoughts and those feelings. And it's truly an honor to be able to get to do that.
Oh, you just brought tears to my eyes. I fully agree with that. What an honor for people when they share what's happening within themselves, because I know the way that we've created society, it's not easy for people to do that. It takes a lot of courage for people to do that, and to show people that you honor that and that you value that is a beautiful thing. And that creates, I think, a lot of trust with people. And I think you are just the right person for this field, for the work that you're doing. It's phenomenal. And so I want to continue and just pick your brain and get all these ideas, because I know there's so much in there. But could you share some final thoughts or messages? Like, what are some things that you really feel people should know? Whatever's in your heart, whatever's on your mind, please share some final messages.
Some final messages. I think largely just you don't have to do it alone. If you want help, there are people who can do it. And I hope that you can find a way that makes mental health care accessible to you, that is affordable, that is culturally competent, and feels like the therapist can truly see you. And to continue the conversation about BIPOC mental health, I do think it's important to note that Mental Health America, an organization, July is BIPOC Mental Health Month, and they just released their toolkit today. And the 2021 theme is Strength in Communities. And that's all the systems of support that were created to support, or by BIPOC folks to support BIPOC folks in mental health. And I think it's absolutely incredible, and I feel very excited for that and all the conversation that's going to happen. So stay tuned for more conversations similar to this about how we can make psychology and mental health multiculturally competent, culturally competent, and accessible to everybody.
Oh, it's so beautiful. It's so beautiful. And, I don't know if you're noticing, but, I feel like I'm seeing that there is more of a culturally diverse choice within therapists compared to perhaps when I was growing up. There was one type probably. And so now it's nice to see that, like you're saying, community supporting community. So if we can create that support within and know that there are people that could understand us, and you don't have to be from the same culture to understand each other, but it's nice that there are options and there's awareness within all cultures, of all cultures.
Exactly.
So, right? Seeing each other as humans and understanding that as humans, we all have similar needs and wants, but there's layers on top of that, right? And so being unbiased, welcoming, non-judgmental, to welcome as many people as we can into that counseling room so that people feel comfortable to get help and just live a better life, right? Ultimately, that's what it's about.
Yeah, so, exactly.
Thank you so much, Hannah, for being with us here today. I loved the conversation. This is right up my alley, super interesting. And I hope that everyone out there got something deep from this, and I'm sure you did. And I just want to say we appreciate you being here with us, Hannah, as well as the audience, and just keep doing the great work you're doing. And we're going to look out for your books and workshops and in the textbook. So, I see big things for you in the future. So also follow Hannah on her Instagram page. Hannah, can you share your Instagram page with us?
Yes, it's at BIPOC, BIPOC _ mental health. And that's on Instagram.
Fabulous.
Yes, please follow.
So much. Follow, see her amazing shares, and just much love to everyone. Much love to you, Hannah. Everyone, live your best life and explore what's within. Release the trauma.
Oh, yes.
Okay, thanks everyone. Have a great day. See you in 2 weeks. Bye.
Bye.